Well, in 2012, I had an infection in my foot and was in the hospital for about 2 weeks. I had to have a toe amputated. That's when I found out they had diagnosed me with diabetes. My name is Larry Havens. I've been coming to community care for several years now. I started back in about 2012 after I had to have a toe amputated. At that time, I didn't have any health care or anything, so when I got out of the hospital, I signed up with MAP. And they're the ones that got me into community care. And then once I got to seeing the primary care physician, she referred me to the specialty clinic for the podiatry.
So when we started seeing Larry, he had a diabetic ulcer on his foot, and we tried many months of offloading, diabetic shoes. He went through a couple of infections that we were able to eventually save his foot through a surgical procedure. And that's really rewarding to us as podiatrists because we can perform wound care, but also we did a procedure in the operating room which helped him offload the front of his foot, which is where he was putting a lot of his pressure and creating that wound.
Personally, I think I'd probably be in a wheelchair by now if it wasn't for them. Because I'd have probably, I wasn't doing the best care of taking care of my feet the way I should with the diabetes. And, and through their teaching and learning how to check my feet and what to keep an eye out for, I've done a lot better.
So we have fantastic primary care doctors here, but they treat the whole patient, but patients also need specialty care, whether it's pulmonology, podiatry, cardiology. The PCP can't deal with everything. So a lot of times patients don't have anywhere to go, so that's why the need for a specialty clinic is so important, especially for our at-risk population here in Austin. We deal mostly with MAP patients, and these patients deserve the same care that everyone else gets.